collective bargaining. If you may recall, that collective bargaining agreement was signed at the point of devolution, and therefore a new structure of government for central government, that is the national government and the county government, had come to effect. And therefore, this collective bargaining agreement could not be registered then without the input of the county governments. Now, this process has gone on in court until that ruling was given, and the court gave the parties who are enjoined in that petition 90 days from October 6th up to January 5th to be able to discuss and come up with an agreement which can lead to registration of a collective bargaining agreement with the industrial court. Now, first, that process is not complete because the 90 days are not yet over. We initiated discussions with the doctors, with committees to be able to continue with the deliberations so that we can meet the ruling of the court. But along the way, the doctors kind of negated on the discussions and gave us 21 notice for strike, which comes to effect in midnight. Further discussions with them led to an understanding that today we shall be meeting at 5:30 to be able to take further that discussion and perhaps come to a conclusion to be able to avert the strike and also to move forward with the negotiations as stipulated in the ruling of the court. During those discussions, of course, the Minister of Health or the national government involved the county, and that is why we have been with Governor Ongwae all through those discussions. On our part, we have consulted widely with the National Treasury, the SRC, the Public Service Commission, and other agencies or stakeholders who could give input to come to a conclusion on that matter. Let me say, all along we were negotiating in good faith, and we still believe that it is not necessary for doctors to go on strike. Now, part of that ruling and part of that collective bargaining recognized that there was harmonization of the scheme of service and the grading or a job evaluation which was being done by the national government to be able to bring harmony within the public service. And that agreement did recognize that any conclusion to that CBA should take into consideration the input of SRC and in particular the conclusion of the job evaluation exercise, which has been now concluded, and discussions have taken in various levels of government. It has come to effect last week and is in the process of implementation. And therefore, this is a document